Mental health, to me, is something that encompasses our physiological health, emotional health, and so much more. It has a huge impact on every part of our lives, affecting our emotions, how we interact with others, the decisions we make, and just how we get through every single day.
Mental health is overall emotional, social, and psychological well-being, and it falls on a spectrum. Some days you're good, some days you're bad, some days you're in between.
To me, mental health is kind of just how physical and emotional factors have an effect on your life and how they can affect your performance and just overall quality of life.
Some symptoms I experience with dealing with mental health is I have a block sometimes. So how most writers have this writer's block, sometimes I have a performance block or an academic block, or I have even a social block. Or sometimes I get stunned physically to where I feel like my gains, if I'm working out or whatever, I feel like I'm not getting anywhere. But academically, I feel like I'm just either plateauing or declining.
Being able to show up for myself at practice and focus enough to get a rep done or a workout, and be able to kind of put on a facade and act like everything's okay and I don't have anything else going on in the background, and just leaving it all at the door before I come practice. That's something that's been pretty difficult to deal with, to just kind of separate the two. Focus, and then just feeling misunderstood in a mental health journey, because it feels like it is so personalized and that nobody else understands what it's like. So just feeling kind of misunderstood or underappreciated for the amount of work that you are able to do, the amount of work that I am able to do. It feels like if I'm just doing the bare minimum, that's not enough. But sometimes that's more effort that it takes than for a regular or an average mentally healthy person to do the average amount, if that makes sense.
Some symptoms that I've experienced with mental health would most definitely revolve around the fact that I find my identity in my sport. And that just has impacted many areas of my life, whether that's how I see my worth in the way I perform, how I see my worth in comparing myself to other people, how I treat my body, whether that's through recovery, through eating, through just any type of way that I'm taking care of myself.
I've actually had a therapist since my freshman year, just because the transition from high school to college alone is daunting, and it's a lot on one's mental health, and then just playing at Division I collegiate level is a lot to deal with. So therapy just more in a life aspect, and then sports performance more specific to my performance and athletics and injuries, stuff of that nature.
Symptoms I've experienced with mental health include extreme anxiety, which has led to burnout, disordered eating, and even panic attacks.
The biggest obstacles that I've had in terms of my mental health throughout college is kind of drawing a line between what can I handle on my own and knowing when I need to ask for help. I think especially as student athletes, we have this idea in our heads, and so many people have this expectation that we can just handle everything all on our own. And in reality, we can't, and we're not meant to be able to do that. That's why we have these people to support us every single day.
The biggest obstacle that I've actually faced with mental health is just the stigma around it. Within the Black community alone, it's hard to really feel comfortable seeking help or telling people that you're seeing a therapist. They kind of look at you weird, might view you as crazy, but it's really not that.
I think the first big obstacle for me would be just reaching out to people in general. I think with the whole stigma, it was hard to reach out initially, and once I did that, things started to get better. I think I relied on my parents a little bit, just being people I could contact to find the resources that I have. Luckily, I've been able to find some outside of my university, because I know the ones on campus are hard to get into.
That's an obstacle that I've struggled with, is that it's enforced for you to be open, but it isn't necessarily enforced as a safe thing, because everybody wants a solution right now, where solutions don't happen overnight. And that's what we want, especially with that goal-oriented aspect of athletes. It's they always want it now, and they need that help now because they don't want anything holding them back. And I think that's a huge obstacle I've seen in other people and myself, of change doesn't happen overnight.
I often work with athletes who are having trouble returning to their sport following an injury. possibly a knee or shoulder injury, maybe a concussion. And there are a number of issues that can delay their return. Sometimes it has to do specifically with the injury, but it may be anxiety or pressure that they're dealing with that they put on themselves to return to their sport. It may come from their teammates or from their coaches. This is extremely common, and if this is happening, you're not alone. There are resources available in your community and at your school to help you deal with these issues so that you can get back as quickly and as safely as possible.
As athletic trainers, oftentimes we are the first point of contact when student athletes, coaches, or teammates have mental health concerns. As athletic trainers, we have the knowledge and the resources to make appropriate referrals to healthcare professionals in both acute and chronic mental health situations. As athletic trainers, we spend countless hours with our athletes, forming those relationships, forming that trust. So it's always been my hope that my student athletes feel comfortable coming to me with both their physical injuries and their mental health injuries.
With us being the primary point of contact, our job then is to make sure that the student athlete is referred to the appropriate provider. We typically are the ones that are listening to any concerns that the student athlete has right off the bat, just because of how frequent our interactions are. But we're not the only one that's involved in the healthcare process for mental health care.
So people in the sports psychology field, sometimes it's called performance psychology, people in that area tend to focus on helping to teach skills that can help people perform the most consistently as possible at the highest level that they can. So a lot of the topics that would be covered in a sports psych consultation would be centered around things like dealing with motivation, pre-competitive anxiety issues, relaxation, imagery, goal setting, maybe dealing with mistakes. So that's really what a person who's in sports psychology does. Some people who are in sports psych also do have clinical or counseling degrees and are licensed in those areas. So they have a much larger scope of practice and can help with areas that deal with more clinical or counseling-based issues like generalized depression or anxiety or eating disorders. But sports psychology does tend to focus more on just the performance-based issues.
What we look for in daily functioning are changes in eating, changes in sleeping. You're not managing your time as effectively. You may not be as motivated to do things. You can't focus as well on your work or in practice. You feel like you're not performing well on the court or off the court. You may be isolating from your family and friends. Those might be all indicators that you might want to go see a counselor or somebody like me. When we meet, we first identify what's going on. We identify the triggers that have brought you into the therapy session, and then we work on managing some techniques to help you with the issue. Sometimes you might meet once a week with your therapist or bi-weekly, and in between sessions, I probably will give you some homework. The most common issues that I treat in the counseling center are depression, anxiety, with some eating disorders, substance abuse issues, recovering from sports injuries, again, stress, maybe something going on in your family life. Your parents might be getting a divorce and it's affecting you. Maybe you're having some relationship issues. Those are all things you could come in and talk to a counselor. Also, reaching out for help is not a sign of weakness. It is a strength. It is a sign of awareness that you're struggling with something and you're willing to work on it and try to manage it and then move on with life as it presents itself.
So my role here centers on providing both mental health support as well as occasional help with performance-related issues. So we do everything from time and stress management, relationship issues, drug and alcohol problems, depression, anxiety, bipolar disorder. You name it, there's a pretty good chance that we work with athletes on it. We provide individual counseling. We will provide some group counseling if it's requested. Drug and alcohol, assessment, for students who may test positive. And we also do teamwork if it's requested. When it comes to working with athletes, Let me just start off by saying that everything is confidential. Information is not released to friends, family, professors, employers, coaches, etc. And sometimes for student athletes, the concern is that athletic culture doesn't always allow for people to be vulnerable or to talk openly about anxiety or depression or other issues. So when students come into our office, we try to provide a safe space for them to be able to address those concerns. In some occasions, students are coming in and they're dealing with pressures from family, from coaches. There may be pressures about their sport, maybe pressures about school or academics or relationships, and just helping them to put things in perspective and to talk through and work through some of those concerns so that they feel like they're getting an individualized experience.
The role of a primary care provider in mental health can be twofold. One, we may have access to the student athletes when they are doing screening or coming in for pre-participation physicals and may pick up on some mental health issues at that time. Or maybe we're seeing them post-injury and same thing, picking up on some symptoms that they may be having. The other role of a primary care provider is to provide medication if that is needed. So in working with their counselor and the student athlete, we find that medication may be the most helpful. Primary care providers can write medication for depression, anxiety, attention, sleep, panic attacks, any of those kinds of issues may be helped with some medication that we have available.
We are more than the sport that we play, and there is more of an aspect to us than the athlete we are, and it's more important to know that the person is cared for first.